Assalamualaikum warahmatullahi wabarakatuh. My name is Auliantika Selian. So today I'm going to present my research paper entitled The Implementation of Health Module to Identify Children's Knowledge, Attitude and Practice Among Preschoolers in Rural Area. So I am from School of Education and Human Sciences of Albukhary International University. So I am the first author of this study. So without further ado, let's proceed with the next slide. So for introduction part, health education is very crucial in early childhood as it can build the foundation for lifelong healthy habits. So rural preschool in Malaysia face few challenges including limited resources, lack of training teachers and also weak of the implementation of health modules. So the National Preschool Standard Curriculum, they promotes holistic children development, but in terms of health education, is not consistently or systematically applied. So this study implemented a health module to identify preschool children's knowledge, attitude and practice regarding personal hygiene and healthy food choices. Also examine teachers' perspective on the implementation of health module and also children's KAP on the process of the health module. The next one, in terms of the problem statement, early childhood education plays an important role in developing healthy habits among children. However, structured health education in Malaysia remains inconsistent, especially in rural preschool. So many preschool teachers lack of proper training, guidance, and also resources, resulting in irregular and informal health education practices. So the absence of the standard health curriculum places the responsibility on the individual teachers, leading to variations in how health topics are being taught. So consequently, rural preschool children may not acquire sufficient health knowledge, attitude, and practice. So furthermore, there is also a limited research which is focusing on rural children's KAP and also teachers' opinion on the implementation of health modules. So we move to the next slide. Based on the research problem just now, there are three research objectives has been developed. The first one is to explain the process of the implementation of health module for preschool children in rural area. The second one is to identify the knowledge, attitude, and practice of preschool children on the health module in rural area. And the third one is to examine the teacher's opinion on the implementation process and preschool children's KAP on the health module. Based on the research objectives, the research question developed for this study, such as the first one is how is the process of the implementation of health module for preschool children in rural area. The second one is what is the knowledge, attitude and practice of preschool children regarding the health module. And the last one is what is the teacher's opinion on the implementation process and preschool children's KAP. So for the literature review, I'm focusing on the three variables of the study. So the first one is the concept of health. Health education in preschool must cover hygiene and nutrition, which is supported by proper facilities and also teachers training. And the second one is poverty and children's health. So rural children face malnutrition and also hygiene problems due to poor access to clean water and also sanitation. And the third one, this study is referring to constructivist theory, which is emphasize learning through active participation and real-life practice using storytelling, songs, and also explorations. So based on this theory, there are certain characteristics which is constructivist theory emphasized, which is in this activity, the teacher is become facilitator in the class, and also the teacher becomes a guidance for the childrens. So it becomes children centered rather than teacher centered. So the next one, based on the literature review just now, there are 7 units teaching health modules. So this teaching health modules actually is divided into two groups. The first one is personal hygiene, which consists of four topics. The first one is about hand washing. So the teacher teaching proper hand washing techniques for the children. And the second one is about toothbrushing. The teacher is actually educating the children on how to effectively brushing their teeth to maintain a dental health. And the third one is hair hygiene, where the teacher emphasizing the importance of the regular hair washing. And the fourth one is nails cutting, where the teacher is educating children the significance of the keeping nails trimmed to reduce the risk of the dirty and germs. And the second groups, which is healthy food choices. The first topic is about fruits and vegetables. The teacher is encouraging the children how to consume the fruits and vegetables for the balanced nutrition for the children. And the next one is grain source of energy, where the teacher educating the children about grains as this is the important energy sources in their daily life. And the last one is drink water, where the teacher promoting how to take the water in daily routine to maintain the hydration and also overall health. So these are the 7 units teaching health modules that have been implemented in this study. Next one is research methodology. So this study was a case study design using a qualitative approach. So this study is fully a qualitative study. The study took place in one of government preschool in Sikedah. Since this study is focusing on rural area, so the suitable place is in Sikedah. So this class consists of 16 children, where only 6 children were selected for in-depth observation. Also include 1 teacher from that class only. So data collection was conducted in 9 weeks using few instruments. The first one is observation checklist with 3 levels, good, average, and low, to see the children's knowledge, attitude, and practice. And the second one is a semi-structured interview with children and also 1 teacher. And we have also video recordings to support the observation checklist, which is this will become a triangulation of the study of the data. So finally, the data were then analyzed using a thematic approach. Based on the analysis just now, the finding of the study have a variation in children's KAP. The first one is in terms of children's knowledge, many children were at a good level for hand washing and toothbrushing, but some at average for healthy food choices, and a few remain at low practice. And attitude, generally children was good, with children showing enthusiasm through although some require encouragement. And for practices, many children perform hygiene routines well. Some were average, needing reminders, and very children few remain low. As the last one, the teacher's opinion, which is confirmed that this module was practical, culturally relevant, and also suitable for preschoolers. But there are few challenges like resource limitation and also lack of parental involvement. To conclude, this study was demonstrated that a structured health module was used to identify preschool children's KAP on personal hygiene and healthy food choices in rural Malaysia. These modules was interactive and culturally relevant, designed to enable the observation of the children's knowledge, attitude, and practice, while teacher perspective confirmed it is practicality and also developmentally appropriateness for the children's. Challenges such as resource constraint and parental engagement remain important as a consideration. So for future work, it should be refined and expand the module. It also needs to explore its integration into the NPSC and need to strengthen teacher training and school-family collaboration to enhance rural preschool health education. So that's all from my presentation today. These are my references for this study. And thank you very much. If you have any question, please feel free to ask me. Thank you so much. Wassalamualaikum warahmatullahi wabarakatuh.